Bismillahirrahmanirrahim. Today I will discuss about basal ganglia or basal nuclei. So basal ganglia or basal nuclei. Basal ganglia are masses of grey matter in the white matter of each cerebral hemisphere. So these are masses of grey matter present in the white matter of each cerebral hemisphere. Basal ganglia include caudate nucleus, putamen, globus pallidus, and also these include substantia nigra and subthalamic nucleus. So caudate nucleus, putamen, globus pallidus, substantia nigra, and subthalamic nucleus. So these 5 nuclei are included in the basal ganglia or basal nuclei. Caudate and putamen are called collectively as corpus striatum. So corpus striatum is the name given to the caudate and putamen. Putamen and globus pallidus are called collectively as lenticular or lentiform nucleus. So lenticular or lentiform nucleus is the name given to the putamen and globus pallidus. Caudate is separated from putamen by the internal capsule. So internal capsule separates caudate from the putamen. Now we come to the connections of the basal ganglia or basal nuclei. Now in the connection of the basal ganglia, 2 circuits are important: putamen circuit and caudate circuit. So in the connections of the basal ganglia, 2 circuits are important: putamen and the caudate circuits. Putamen and caudate circuit. So first about the putamen circuit. Nerve fibers arise from the premotor and supplementary motor area. And also somatosensory area. You see, from premotor area, supplementary motor area, and also somatosensory area, nerve fibers arise, and these go to the putamen. Bypassing the caudate. These go to the putamen. From the putamen, these go to the globus pallidus, and from the globus pallidus, the nerve fibers pass to the ventro-anterior and ventro-lateral nuclei of thalamus. So these go to the ventro-anterior and ventro-lateral nuclei of the thalamus. From these nuclei, nerve fibers arise, and these nerve fibers go to the primary motor area, premotor area, and supplementary motor area. So from the ventro-anterior and ventro-lateral thalamic nuclei, nerve fibers arise, and these go to the premotor, supplementary motor, and also the primary motor area. So this is the main putamen circuit. I revised: nerve fibers arising from premotor and supplementary motor area and somatosensory area, these go to the putamen, bypassing the caudate. From putamen to globus pallidus, and from globus pallidus to thalamic nuclei, ventro-anterior and ventrolateral thalamic nuclei, and from here nerve fibers go to the primary motor area, supplementary and premotor areas. This is the main putamen circuit. Now, in addition, there are associated connections with this circuit. You see, from the globus pallidus, nerve fibers go to substantia nigra, then to thalamic nuclei, ventro-anterior, ventrolateral, thalamic nuclei, and from here, these go to the cerebral cortex. Another additional connection with this circuit, from globus pallidus to subthalamic nucleus, and then to thalamic nuclei, ventro-anterior and ventrolateral thalamic nuclei, and then to the cerebral cortex. Right? Another additional circuit, connection with this circuit, is from globus pallidus to subthalamus, and then from subthalamus back to globus pallidus. From globus pallidus to subthalamus, and then back to the globus pallidus. So this is the putamen circuit in the connection of the basal ganglia. And the circuit is caudate circuit. This is the caudate circuit. Right? In the caudate circuit, nerve fibers arise from prefrontal cortex, premotor and supplementary motor area, and somatosensory area. You see, from prefrontal area, premotor and supplementary motor area, and from somatosensory area, nerve fibers go to the caudate. Nerve fibers go to the caudate, bypassing the putamen. From caudate to globus pallidus, and then from globus pallidus to thalamic nuclei, ventro-anterior and ventrolateral thalamic nuclei, and from these nuclei, fibers go to mainly to the prefrontal cortex and premotor area. Right? You see, these fibers go to the prefrontal cortex and to the premotor area. So no connection with the primary motor area. You have noticed? No connection with the primary motor area in the caudate circuit. So I divide the caudate circuit, nerve fibers from the prefrontal cortex, premotor and supplementary motor area, somatosensory area go to caudate, bypassing the putamen. From caudate to globus pallidus, and from globus pallidus to the ventro-anterior and ventrolateral nuclei of thalamus, and from here nerve fibers go to the prefrontal cortex and premotor area. No connection with the primary motor area. So this was about these connections of cerebellum of the basal ganglia, the putamen circuit and the caudate circuit. Now there are important neurotransmitters in the basal ganglia. So neurotransmitters in the basal ganglia. Corticostriate fibers are cholinergic. Corticostriate fibers are cholinergic. I mean fibers arising from cerebral cortex, these go to the caudate and putamen. Caudate and putamen. These nerve fibers release acetylcholine at the nerve endings, and these nerve fibers are cholinergic. So corticostriate fibers, nerve fibers passing from cerebral cortex to caudate and putamen, these release acetylcholine at the nerve endings, so these nerve fibers are cholinergic. So don't forget, corticostriate fibers are cholinergic. Then nigrostriate fibers. Nigrostriate fibers, I mean fibers arising from substantia nigra, and these fibers go to the caudate and putamen, the corpus striatum. So these nerve fibers release dopamine at the nerve endings. These release dopamine at the nerve endings, right? So nigrostriate fibers are dopaminergic. These are dopaminergic. These release dopamine at the nerve endings. So nigrostriate fibers release dopamine at the nerve endings. Then nerve fibers which arise from caudate and putamen, and these go to the globus pallidus and substantia nigra. These release GABA, gamma amino butyric acid, at the nerve endings. So nerve fibers passing from the caudate and putamen, going to the globus pallidus and substantia nigra. These release GABA, gamma amino butyric acid, at the nerve endings. Right? So these release GABA at the nerve endings. Then nerve fibers from the brainstem. Nerve fibers from the brainstem which come to the basal ganglia. These release norepinephrine, serotonin, and enkephalin at the nerve endings. So nerve fibers from the brainstem going to basal ganglia, these release norepinephrine, serotonin, and enkephalin at the nerve endings. You know, acetylcholine is an excitatory neurotransmitter. Dopamine in the basal ganglia act as a inhibitory neurotransmitter. Similarly, GABA is also an inhibitory neurotransmitter. Acetylcholine, excitatory. Dopamine, inhibitory in the basal ganglia. And GABA is also an inhibitory neurotransmitter. So this was about the neurotransmitters in the basal ganglia. Now the functions of the basal ganglia. Functions of the basal ganglia. The first function is control of complex or fine-skilled motor activity. Control of complex or fine-skilled motor activity. Keep in mind, basal ganglia do not function independently. These do not function independently. These function with the help of the cerebral cortex and the corticospinal system. So basal ganglia don't function independently. These function with the help of the cerebral cortex and the corticospinal system. And the function is control of complex or fine-skilled motor activity. Examples of this motor activity is complex motor activity, writing, speech, cutting designs with a scissor, cutting design with scissor, hammering the nail. You strike the nail with the hammer, so hammering the nail, playing basketball. Playing basketball, the player has to push the ball into the hole. This is also complex, fine-skilled motor activity, right? So these are the examples of fine-skilled motor activity: writing, even the speech, talking, cutting design with the scissor, right? Playing basketball, hammering the nail, right? So this motor activity, which is fine-skilled or complex motor activity, is controlled by the basal ganglia with the help of the cerebral cortex and the corticospinal system. The next function is cognitive control of the motor activity. Cognitive control of the motor activity. Cognitive control of the motor activity. It is the control of the sequence of the motor activity, control of the sequence of the motor activity in order to achieve a specific goal, right? So control of the sequence of the motor activity in order to achieve a specific goal, a specific aim, a specific purpose, right? So control of the sequence of the motor activity in order to achieve a specific goal, a specific aim. Now in this function, help is taken by the sensory input. Help is taken by the sensory input and the information already stored in the brain. So sensory input and information already stored in the brain. What is the cognitive control of motor activity? I give you an example to explain. A person is walking along the road. Suddenly, he looks upon a tiger. So, a person walking across the road looks upon a tiger. Now, when the person looks upon the tiger, the purpose will be, the aim will be to save life. To save life, he will run away. He may climb up some height. He may hide himself in a safe place. So this sequence of motor activity to save life is formed. He may run away. He may climb up a tree, climb up a height. He may himself hide in a safe place. So this sequence of motor activity in order to save life is controlled by the basal ganglia. Of course, sensory input is important, that tiger is coming. And then information stored in the brain that tiger is a wild animal. He will damage, he will harm, right? So this is the cognitive control of the motor activity, the function of the basal ganglia. So this function involves the caudate circuit. So caudate circuit is involved in the function that is the cognitive control of the motor activity. Now in the last function I discussed, the control of the complex motor activity, involvement of the putamen circuit. in the control of the complex motor activity, there is involvement of the putamen circuit, and in the cognitive control, involvement of the caudate circuit. Next function of the basal ganglia is control of intensity and timing of the movement. Control of the intensity and timing of the movement of motor activity. Now, a person wants to write letter A, right? He can write letter A of this size. He can write letter A of this size, right? He can write letter A of small size and can write letter A of large size. Now he can write letter A with a slow speed. He can write letter A rapidly, right? So you have seen in the writing of letter A, person can control how large the movement will be, and how rapid the movement will be. Now, so I am discussing about the control of intensity and timing of the motor activity by the basal ganglia. And person is able to control how large the movement will be. I can write small letter A, I can write large size letter A. So how large the movement will be, and then how rapid the movement will be. I can write letter A with a slow speed. I can write rapidly letter A. So in this function, the basal ganglia controls how large the movement will be and how rapid the movement will be. Now in this function, there is involvement of the caudate circuit. Now basal ganglia also function with the help of the posterior and superior parietal cortex. So basal ganglia function with the help of the posterior parietal cortex. Now if there is a region of the posterior parietal cortex, there will be a special sensory deficit which is called amorphosynthesis. Amorphosynthesis, also called as personal neglect syndrome. Personal neglect syndrome or amorphosynthesis. Personal neglect syndrome or amorphosynthesis. Let us say a patient is having lesion in the posterior parietal cortex on the right side. Now in this region of the posterior parietal cortex on the right side, the effect will be on the left side. Now if you ask the person to identify some object by touching with hand. You ask the subject, you ask this patient to identify some object by touching with hand. He is able to identify the side of the object touched by the right hand. He is not able to identify the side of the object which is being touched by the left hand. The left hand. Right? So this type of sensory deficit is seen in this patient. Now if he is asked to draw, say, a clock and a flower, this is the normal drawing of the clock, right? And this is the drawing by this patient having region of the left side, right-sided posterior parietal cortex. So this patient with region in the right-sided posterior parietal cortex, this type of the clock he will draw. And you see the left side of the clock is not properly drawn. Only right side, not left side. Similarly, in this flower, the normal person drawing, and this is the drawing of the patient having the posterior parietal cortex region on the right side. You see, left side of the flower is not properly drawn by this patient. This is called amorphosynthesis. Now, moreover, this patient neglects the left side of the body even for the motor activity. This patient neglects the left side of the body even for the motor activity. He will not use left side of the body for the motor activity. He ignores left side of the body for the use in the motor activity. It appears that the left side body is not even existing for that patient. He will ignore, he will neglect the left side to be used in the motor activity. It is also called amorphosynthesis and personal neglect syndrome. Personal neglect syndrome. So this was about the functions of the basal ganglia. I told you about control of complex or fine-scaled motor activity, cognitive control of the motor activity, then control of the intensity and timing of the motor activity, and then we discuss about the amorphosynthesis and personal neglect syndrome. So we stop here.